Morning everybody, hope you're doing okay. I'm out on the roads again, which is great, but I thought I would bring you the next video looking at using PBM for certain conditions. We've talked quite a lot about musculoskeletal conditions so far, and we'll kind of keep on with that theme. We'll expand on a few more of those in the next few weeks, but I wanted to bring in maybe a newer concept for some people. We talked quite a lot about this at LVS last week, but using PBM for abdominal conditions, and again conditions that maybe we wouldn't typically think of using laser for. So specifically I'm going to start with large bowel diarrhea or idiopathic diarrhea, and again, probably not what you would think of using your laser for, but when we go back to those basics of have we got pain, have we got inflammation, have we got tissue damage? Now obviously we're not necessarily in the tissue damage area here, but in terms of pain and inflammation, absolutely. So we can really again benefit here. Now there's many different causes for diarrhea, and we're not just talking one type of diarrhea here. This is applicable for all different types, whether it's a stress factor that's causing it, whether it's viral or something else going on. We're going to be talking about the same condition, just there's multiple of reasons why we get diarrhea, but how do we use PBM to help manage symptoms? Now, in terms of research, this is one I can link directly to a paper, which is great. So for those of you that have seen, Dr. Alva's published a paper recently, I think it's a year or so maybe, on idiopathic large bowel diarrhea. And within that study, so those of you that are familiar with Dr. Alv's research, he works for a working dog non-profit, so he has access to all sorts of working dogs. And with these dogs, part of their high drive, they get a lot of stress. Part of that is the impact on their body, and when you're doing a lot of exercise, a lot of again high drive work, naturally there is going to be some impact on the body, and one of those common themes is idiopathic large bowel diarrhea, as we mentioned. So in this study, he took a group of 15 dogs, split them into a control and treatment group. Now as a control, they used psyllium husk, which is a prebiotic fibre, again used very, very commonly to help try and bind them so that we can again reduce obviously diarrhea. And then in the treatment group, they used laser therapy to again, let's see what the difference is. Now it's very common in these working dogs that their body scores are naturally lower than our average pet, because again the type of work they're doing. So body score for them is around 3 out of 9, and that's considered normal. And with these dogs, their diets are tailored to them, so they're on slightly different foods to our standard pets, but they're monitored very, very closely because of how low their body conditions can be. And again, any kind of stress factor, any extra pressure on the body, diarrhea, could then obviously cause quite a few issues for them. So in this study, they compared the two. So they treated these dogs for 3 weeks. So in the laser therapy group, they had 3 treatments in the first week, 2 treatments in the second week, and then 1 treatment in the third week. And they again kind of did body condition scoring. They looked at the fecal index charts, vast range of different tests, and again it was double blinded and controlled. So again we've got that nice element of we're not just going, okay, we think they're looking better because we know who's had what. It was in a controlled environment. And long story short, what they saw was actually ultimately both groups improved. And that's a really important factor here, that we're not saying that psyllium husk doesn't work, because it's something that's been used for a long time. But what was the difference was they saw a significant improvement in the photobiomodulation group. So it wasn't just okay, they're both good, but marginally there was a significant difference in kind of body condition scores, again fecal index, and in some cases what they actually saw was within, well, I'm going to say within 24 hours, but I'll tell you about one case in a moment. They actually saw dogs go from completely liquid stools through to fully formed solid stools. And those of you that know when you've had a dog with diarrhea, that's a challenge to achieve. There's nothing worse than kind of that first 24-hour period when you know it's going to be all hands on deck. And one of the cases, they actually literally saw the dog go to the toilet before treatment, before laser therapy, and again absolutely classified as diarrhea. They treated, and within half an hour the dog actually went to the toilet again, and again there was kind of enough change there to show that it had a benefit that quickly. And you know, the principles around this are, as I said, we're reducing inflammation, we're in making them a lot more comfortable, and they reported actually that many of the dogs in the treatment group, they were going to sleep during their treatments. They were that much more comfortable. Their body conditions, you know, improved very quickly. So it wasn't just about you know, making them more comfortable, but actually their general health better overall as well. So what I'll do is I'll link the study in below so that you guys can check it out, because to be honest it would take me a lot longer to discuss all the ins and outs of the study, and there is a webinar also if you want to listen to Dr. Alf's talk about the study in more depth. I'll pop a link in the chat for you. One of the key things though, and I'm going to start mentioning this on all research because I think this is a key point that we haven't talked enough about. With any of these research papers, a laser isn't just a laser. They are not the same. Every laser generally is slightly different. So it's really important that when you're trying to replicate, you know, these treatments from these studies, we must be making sure that we are using the same parameters. You know, wavelength, fluence calculation, dose calculation, are we contact, off contact, because that is going to impact your results for your patients. So great to be aware of data, and it's really you know, there's been big strides in terms of what data we've been getting, but please make sure when you are then trying to replicate this on your own patients, just make sure you spend a bit of time looking at the study itself and what the parameters were, because otherwise you may not find that you get the same results in your patients. So make sure you kind of double check them. If you're not sure, give me a shout. I'm always happy to help wherever I possibly can. So I hope that gives you an idea of what else you could be using it for. Yes, I know a lot of you are rehab focused, but how many of our patients also suffer from bouts of diarrhea every so often? So that's the first abdominal one. We'll chat about another abdominal condition in the next one.